How can your dentist tell by what type of pain you have, what treatment do you need? I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry and Orthodontics. I'm a board-certified pediatric dentist. Pain. There's so many different types of pains. It does take a while and also ability to listen to your parent or child or your patient who can express themselves to figure it out what treatment do they need. Our best tools are x-rays, but also description of what you experience is extremely important for me personally because pain can be different. Now I'm gonna tell you what type of pain sensitivities you can have and what type of treatment you may need. So number one, cold sensitivity. Cold sensitivity can be for so many different reasons. It can be just new teeth erupting on the child and they have more porous enamel and the kids just feel more sensitive to cold. For example, common in 8-year-olds when they eat ice cream, they say, oh, and usually it's no cavity, it's just the sensitivity to coldness because of porous enamel. What to do? Sensodyne toothpaste usually is one of the best ones for just generalized cold sensitivity, but don't ignore your dentist because you have to go and take x-ray. X-ray gives us more information. Number two, throbbing persistent pain. When you or your child feel that one tooth always bugs you sporadically out of nowhere, that might be indicative that there is a cavity and the cavity is getting close to the nerve. So that's throbbing, frequently occurring pain, usually indicative that the nerve is involved. Then you can have acute pain. I wish nobody experienced that, but it's a type of pain which makes you cry. Your kid would be crying, you would not be able to sleep. Worst type of pain ever. I actually experienced this type of pain on my personal level when I was pregnant with my second child. I woke up one morning and I knew I have to see a dentist immediately. I had a deep filling and then cavity formed under that and I needed root canal. So it was a severe pain. Tylenol didn't help, ibuprofen, nothing would help. It was just on and on and on. What it means that the teeth have nerves inside. So when you experience that awful pain, it means nerve is dying. It goes through necrosis process and then infection forms. And then infection can actually travel from the tooth out of the tooth into the bone. That's when you develop swelling, and then it can be systemic involvement. If your immune system cannot handle, you can have facial swelling, can actually spread and can be life-threatening. So that severe pain needs immediate attention. Also, you can have sensitivity or frequent pain after you had the filling done. For example, you bite down on that tooth and it just hurts. So usually it's indicative that the filling may be high. So if you just had a filling done and you have that biting pain when you bite down, most likely it's just a high filling and just needs an adjustment. That's another type of pain. Another type of pain when you eat some different type of foods and all of a sudden your tooth aches. Most likely you either have a cavity or you have open filling. Sometimes fillings, if they're not filled fully or developing cavity under a filling, you might have that unusual pain associated with eating. So for example, you're chewing and you feel like, especially with sweets, you eat that sweet candy or drink that juice I was telling you not to, and you get like, oh, it hurts, and then you rinse your mouth, brush your teeth, and kind of goes away. It is indication that most likely those microscopical tubules of the dentin are exposed, that sugar goes in that and creates sensitivity and it radiates all the way to the nerve of the tooth. That creates that type of pain associated with eating. Very unusual type of pain also can be developed when you drink something hot. It's usually indicative that, again, nerve involvement is present or the pulp is affected. So in this case, you might have pain associated with hot drinks. Not very common, but that is another type of pain. So me as a dentist, I have to figure it out. That's why I ask you a lot of questions. Okay, does it hurt at night? Does it hurt when you bite? Does it hurt when you drink cold or hot? And by asking all these questions, I gather all that information to figure it out what the optimal treatment is. Because if you have severe pain, you most likely will need root canal, or on kids, we need to extract the baby tooth or the pulpotomy. If it's something aching here and there, most likely a small cavity, then we need a filling. So it's all diagnostic analysis and gathering information, gathering the right data. What I want you to remember is don't ignore your body. If something aches, it will turn into severe pain eventually. When your kid, it looks like has a cavity and complains here and there, and you kind of, oh, maybe later, it turns into that emergency with a swollen face when we have to put them on antibiotics, sometimes go to the hospital. So don't ignore your dental health. Your head, your teeth is part of your overall body and your health in general. So extremely important to take care of your teeth because it's part of you and helps you with so many different things. Share with me if you had that horrible pain like I did when I was pregnant. I'd like to know. And if you liked my video, please share and like. Thank you for watching.